Hello friends, welcome back to Complete Medical Coding, a complete CPC learning channel. Today, let's discuss about the cardiovascular system. In this chapter, we will learn about the guidelines and some of the practice questions which are related to the cardiovascular system. So, let's move on to the chapter. So let's move on to the common guidelines in the cardiovascular system. These are the 30,000 series and it ranges from 330102 to 39599. Now let's see what are the rules which are related during the insertion of a pacemaker or a defibrillator. This is an important part. So during the insertion of a pacemaker or a defibrillator, we need to check the following. If the pacemaker inserted is temporary or permanent, then what procedure is being done? Like it can be an insertion, it can be a replacement, if it is upgrade, relocation, repair, removal, or reposition. We need to check which procedure is being done. Also, we need to check for the leads, if it is a single leads or dual leads or multiple leads. Now, this is also another important part when we code for a CABG surgery, that is coronary artery bypass grafting. So, if a bypass surgery is included, it will be always with pump oxygenator, even though in the question if it is not mentioned with pump oxygenator or without pump oxygenator. If a bypass grafting is included, it means it is always with pump oxygenator. So we need to code for the one which is with pump oxygenator. Now, cardiac valves. Which are the 4 cardiac valves? Just for your notification, I am just mentioning it here. Just for your knowledge. Aortic, bicuspid or mitral, tricuspid, and pulmonary. These are the 4 cardiac valves. Now, another point to remember when we report CABG codes. So, the code range from 33510 to 33516 are used to report CABG procedures using venous grafts only and should not be used to report CABG procedures for arterial grafts. It means if the question is related to venous graft, in the question if it is mentioning a CABG surgery is being done using venous graft, then we need to code report only. The range will be, these are the range from 33510 to 516. From that you will get a code to report the CABG procedure using venous graft. We should not look for the code which is related to the arterial graft. Okay, if the question is related to venous graft only. But if the question is related to a combined arterial and venous graft, see, just check the last point which I had mentioned it in blue color. For combined arterial and venous grafting, first code for arterial and then code the combination venous code. So, if it is a combined arterial and venous grafting, we need to first code for arterial and then the combination venous code. That's how we need to code it. But if it is only using venous graft, then we will code only for the venous grafting only and not for the arterial graft. What are the other points? Saphenous vein graft, it is also included in these code ranges like 33510 to 33516 and should not be reported separately. If any saphenous vein graft is mentioned in a question, we should not need to report it separately. It's already included in the venous graft. Now, use 35500 to report harvesting of an upper extremity vein. in addition to bypass. In addition to a bypass surgery, if there is a harvesting of an upper extremity vein, we need to use the code 35500. By default, we need to use the code. And if it is an upper extremity artery, in addition to bypass, then we need to use the code 35600. If it is a femoropopliteal vein, we need to use the code 35572. These are the 3 points which are mentioned here. Codes 35500 used to report harvesting of upper extremity vein. 35600 used to report harvesting of upper extremity artery. And 35572 is used to report harvesting of a femoropopliteal vein. If these procedures are marked in the question. Okay. Now, let's move on to the next guideline. Central venous access procedures. These are also important. The venous access device or catheter may be either centrally inserted or peripherally inserted. These procedures for these types of devices fall into 5 categories. There are 5 categories how a device is inserted. A device can be inserted or repair or replacement, whatever it is. So in that it will fall into 5 categories. Either insertion, repair, partial replacement, complete replacement, or removal. So from the question we need to identify which procedure is being done. Insertion means placement of a catheter through a newly established venous access. It means insertion. Repair, fixing device without replacement of either catheter or pump other than mechanical correction of the intracatheter. Repair means just a correction of the catheter and not a replacement. Partial replacement means only catheter component is being replaced and not the entire device. If entire device is being replaced, it's a complete replacement. Entire device via same venous access site. Removal means removal of entire device. Another few more points to remember during the central venous access procedures. We need to check if it is a tunneled or non-tunneled catheter. The age also we need to check if it is less than 5 or greater than 5, with or without port, how it is used, or with or without pump. All these are also important questions. There is one table. I'll be moving to that table. See, here is a table that you can find out in the CPT codebook. I'll show you in the codebook as well. This is just a picture of that. I think it's not visible to you. I will be showing you the CPT codebook. In that, everything is mentioned. In the table, you will find it easily how to find the codes for this central venous access procedures. I'll show you the table. Just look into this table. See, this is the table from the CPT codebook about the central venous access procedures. In this table, it's mentioned if it is a insertion, if it's a repair, partial replacement, complete replacement, or removal. All these 5 procedures that I had just mentioned, it's written it here. It's mentioned it here. Also, if it is a non-tunneled catheter, tunneled catheter without port. So if it is a centrally tunneled with port, tunneled with pump, peripheral, then age, as mentioned, less than 5 years or greater than 5 years, or any age. So from this, you can easily identify, you can easily find out the codes. No need to check all the codes one by one. For example, a catheter is inserted. A central venous catheter is inserted without imaging guidance, and if it is a non-tunnel catheter, you can use this code 36555. It depends on the age. If it is less than 5 years, 36555. And if it is greater than 5 years in the question, you need to use 36556. Like that, each and everything you can mention. See, if it is without port, also check the age. This is less than 5. If it is without port for greater than 5 years, greater than or equal to 5 years, you need to use 36569. So like that, similarly, you can identify all the codes, whether it's inserted, repair, partial, complete, replacement, removal, everything you will be getting from this table. You can easily identify this table. So I hope you understand this table. If you have any inquiries, if you have any doubts, you can always ask me in the comments and I'll be happy to assist you with that. Okay. So let's move on to some important practice questions. The first one, code for relocation of pacemaker pocket. This is a direct question. You will easily find it from the index page. Today I will just show you how to use the index page, how to check the codes from the index page. So it will be more helpful to you. So here it's mentioned relocation of pacemaker pocket. So you need to go for the pacemaker. You need to check pacemaker first. So when you go to the index page, pacemaker will be here. See, but here it's mentioned see cardiac assist devices. So you need to go to cardiac assist devices. So go to C and you will get cardiac assist devices. Yes, it's here. Cardiac assist devices. In that, what is our question? Relocation of pacemaker. Pacemaker. So from here we need to find out where is pacemaker. So check where is pacemaker. All these are in alphabetical order, so it will be easy for you. See, pacemaker system is here. And in that, relocation we need to check. See, relocation. Relocation of skin pocket. The code mentioned is 33222. Now just go to the code. Sometimes they will put the exact code, sometimes it will be a range like this. So now it's the exact code that they have mentioned, 33222. So we will just take the code 33222, which is here. Relocation of skin pocket for pacemaker. So our answer will be correct. Even though the code is mentioned in the index page, you need to double check if it is correct or not. So here 33222 is the answer. Relocation of skin pocket for pacemaker. This is how you need to check the index. From the index page, you need to go to the codes. So similarly, the second question, code for catheter placement into the brachiocephalic artery, first order. So here you need to go to the index page and search for brachiocephalic artery catheter placement. You will directly get the answer 36215. Now let's move on to the third question. This one I will show you from the CPT code book. Complete replacement of tunneled centrally inserted central venous device with subcutaneous port. Replacement performed through original access site, 45-year-old patient. What will be the code? So this type of centrally inserted central venous access procedures, I told you, you can easily get from the table which I had showed you before. No need to go and check the index page and checking the codes. It's time consuming. So better to go to the table first. I'll show you the table once again. Let's move on to the table. So we are in the table right now, the one which I showed you before. So here our question is complete replacement of tunneled centrally inserted central venous device. So complete replacement. So from here you need to go to complete replacement. Okay, so we are here. Tunneled centrally inserted. tunneled centrally inserted can be here tunneled. But is it is with or without? In our question it is with subcutaneous port. So with port, tunneled with port or with pump. It is here. It will be here. And then centrally inserted central venous device. This is device. Catheter, here it's mentioned. Catheter without imaging guidance, catheter with imaging guidance, and device separately. So you need to check for the device. And what is the age of the patient? 45-year-old patient. 45-year-old patient. So greater than 5. Here it's not mentioned anything less than 5, greater than 5. So we need to go to any age. See, one option is there at the end, any age. So it can be this option. This code will be for any ages. If the age is not mentioned in the question also, you need to code this one, 36582. So 36582 will be the code. Because our question is complete replacement, device, not catheter, device. See, everywhere it's mentioned separately, catheter and device. So check carefully the question. Then tunneled with, see, tunneled with pump, 36582. Tunneled with port, centrally tunneled. So this will be the answer, 36582. Because the age is mentioned, we need to check here. Okay, this is how you need to find the code from this table for all the central venous access procedures only. Okay. And then you can cross check if this code is correct. See, 36582, replacement complete of a tunneled centrally inserted central venous access device with subcutaneous port through the same venous access. So this will be the answer, 36582. Similarly, another question, code for the insertion of a non-tunneled centrally inserted central venous catheter. CVC means central venous catheter for a patient 3 years of age. What will be the code? Similarly, you can go to the table. I'll show you the table once again for you. Let's move to the table. See, here in this table, here our question is insertion of a non-tunneled. So insertion of non-tunneled centrally inserted CVC, centrally inserted CVC catheter. Okay, for a patient of 3 years of age. Here in bracket it's mentioned without imaging guidance. In our question there is nothing related to imaging guidance, so it is without. And what is the age of the patient? 3 years of age, so it will be less than 5 years. So this will be the answer, non-tunneled CVC 36555, less than 5 years. Okay. And if you want, we can check 36555. Let's go to 36555 in the CPT code book. Yes, it's here. Insertion of a non-tunneled centrally inserted central venous catheter younger than 5 years of age. So this is how you need to find the code. Now moving on to one more question, last question. Dr. Sygoski performed 4 coronary artery bypass grafts using 4 venous grafts. What will be the code? This guideline I had mentioned earlier. If for a bypass grafting, for a CABG grafting, if they are using only venous graft, you need to code only the venous graft code, not the artery code. Okay. So here, using 4 venous graft means the doctor has used venous graft only for the CABG surgery. So when you go to the index page and check venous graft, you can find the code range 33513. Let's take 33513 in the CPT code book. I will just show you because I'll just tell you how to find it out. 33513. If you move to 33513, because the code range I had already mentioned earlier, for venous graft, it will be from 33510 to 33516 only. So here, the doctor performed 4 coronary artery for CABG using 4 venous graft. So when you go to coronary artery bypass CABG from the index page, you will end up in the code 33510. This code range you will end up. So when you go to that code range, 33510 is for single coronary artery, coronary venous graft. No, ours is 4. So when you move down, you will get 33513 for coronary venous graft. Because here only venous graft is performed. This is how you will find the answer. Okay. So I hope you understood all these 5 practice questions. If you have any doubts, any inquiries, you can please mention it in the comments and I am happy to assist you. So friends, that's all about the cardiovascular system. If you like the video, please subscribe to my channel. If you have any inquiries or any doubts related to this chapter, please mention it in the comments. See you on the next episode. Bye.